Welcome back to the Morning Blend. Did you know more than 65 million Americans provide some form of care for impaired, ill, or aging adults? November is National Family Caregivers Month, an excellent time to focus on taking care of our entire families.
That's right. Here with more with Healthcare Partners clinical educator is Aliberti. Ellen, it's a pleasure to have you again.
Good morning.
Once again, it's great to be here.
National Family Caregivers Month. What's this month all about?
Well, you know, President Obama administration declared it National Caregivers Month to really acknowledge all of those family members, friends, and neighbors that provide countless hours to caregiving.
It's a lot of responsibility, isn't for the caregiver. It's very stressful as well on them.
Yeah, it's extremely stressful, and really what we need to appreciate about as caregivers is be mindful that you have to take care of yourself and be mindful of caregiver stress, which is a syndrome.
Yeah, well, I would imagine it is, because not only are you caring for your life, and your life doesn't stop, but you must be caring for another person's life as well. How do you balance that?
Well, this is a really important question. So be mindful of the symptoms. So we've got loss of appetite, chronic fatigue, and really just losing interest in the things that you enjoy. And so what's really important for caregivers is to acknowledge that they need some help and to hopefully ask for it.
Yeah. So a lot of challenges, and don't be afraid to say, hey, I need help too. And that's where you guys can come in and help some people around the valley as well.
Right, because if you know, caregiving, it's endless, and we need to encourage them to ask for help and get their own health care, because what happens when you're caregiving is you're letting your health go to the wayside, and then it's very troublesome for both.
Let's talk about some of those services that Healthcare Partners can help with.
Okay, I'd love to talk about Healthcare Partners, because as you know, Healthcare Partners, we have the total care model, which can help our seniors and their caregivers figure out what's best for them. We have care coordinators, providers. We can help you with transportation, even a grocery list of healthy things to eat, and schedule your appointments, caregivers, so you are also getting help and cared for.
And we're in the middle right now of open enrollment for seniors.
Yes.
So this is an important time for them.
Yes, open enrollment started on October 15th. It's going to go to December 7th, and let's not confuse it with the Obamacare and so forth. It's totally different. Medicare beneficiaries don't have to do that. They just have to decide about their Medicare benefits.
And not every program is the same, and there are different deals with different situations.
That's right. So reach out. We have a lot of things going on this month to celebrate open enrollment. So go to www.hcpnv.com.
Awesome.
And seniors can learn and get some new information there as well, or just a refresher on why they like their plan as well. It's important.
It is important, you know. Check out what are your options, and hopefully choose Healthcare Partners, because we are dedicated to our senior patients, all of our patients for a matter of fact, doing total care. And thank you. I wanted to say thank you to the caregivers out there. We could not do our job without you, and thank you so much.
One thing that you mentioned, by the way, with open enrollment is, even though you're on a plan, you're like, oh, well, I liked that plan when I signed up for it. Doesn't mean that plan hasn't changed since you signed up for it.
You're right, Sean. You have to really, take a good look and see what the changes are and make the best decision for yourself and your family.
And when you're within the network of the partnership there, the doctors have access to other records, so that's where the total care model comes in. They're talking to each other.
Yeah, we have an electronic health record that encompasses all of our clinics and our urgent cares, so our patients, even if they're not being treated by their doctor because they're in a different situation, we have their medical records. It's very important in terms of care coordination.
We got about 30 seconds left. Should we be making a game plan? Should we need care? Should we make that game plan while we're still able to?
Yes, it's a great question. There's a lot of things that you need to be doing to get ready for this. So think about who can help you, what kind of things that you need help with, and really acknowledge that you need help, because there's a lot of services out there, caregiver support groups, lots of things that we can do.
And the next time
Make
you
a
come
plan.
back, we'll talk about that healthcare directive again. So
We are going to
important.
talk about it again.
Yes.
It's our homework.
Again and again.
Thank
We
you,
are.
Ellen, we love you. Thank you so much.
Thank
For
you.
more about National Family Caregivers Month or to learn more about the open enrollment process, just head to the website on your screen.
Still to come on the Morning Blend.